Right, it looks like most of the participants have been let in. So once again, I'm Crystal Tyler-Mackey on behalf of the Virginia Cooperative Extension Human Development Team, welcoming you to this edition of our Balance in Life series. We're pleased today to welcome Dr. Shannon Jarrett, who will be talking with us about older adults. I was so happy to reach out to Shannon, who is an expert in this field. She's also our co-project director on a joint Ohio State and Virginia Tech, Virginia Cooperative Extension grant-funded project, Food for a Long Life, funded through USDA STIFAR programs. So without further delay, join me in welcoming Dr. Jarrett.
Hi, good morning. I'm really glad to see Crystal and to have the chance to talk to you, and especially to have learned about the experiences with this webinar, that there have been some other sessions. You older adults would have been relevant to address in those previous units, which I understand are recorded if you're new to this session and want to check them out, because older adults are parts of families and they're important, integral parts of all of these families. So there are older adults who are taking care of, raising, and missing 0 to 3-year-old children. They're parts of marriages and relationships, partnerships. And so today, we're going to talk about older adults and the family members that they connect with and maybe that they're missing out on. We know that being at home is hard, and it can be especially isolating for older adults who are being told to stay at home because they're categorically vulnerable because of their age. There are a lot of things that older adults get done in the community, and so not only are they missing the roles that they play and the people they see, but we're missing their contributions in our families and in our society as well. So I'll talk about the roles that older adults play in family and community relationships. I'd be remiss not to start with the basics. Let's see if, like the basics, can I advance this slide? So by now, you've all been living in these strange circumstances for several weeks, and you probably have some new routines. You may be using new technologies and strategies to meet those needs and those for whom you care. But some of you may have been getting along, or the people that you care for are looking out for, they've been getting along all right the last few weeks and are now finding that they could benefit from some resources they haven't previously accessed. So I do want to talk about those. For example, with food, we've seen the ads. We can advise our older adults. You know, I don't know about old dogs, but old people can learn new things, I hate to even call them tricks, because these are important skills to order groceries online and to pick them up at the store, or to have them delivered to the older adult's home. That's a resource to consider. Congregate meals may or may not be a resource that you or an older adult has used, but these centers are now working to offer drive-up service or to have meals delivered for older adults. Meals on Wheels, food banks may be a new resource to you. They are also offering drive-up and no contact provision of services. With regards to medical care, there are hospitals and doctors' offices that are still seeing patients. Some older adults need routine visits to keep up with medications. You can try out telehealth. Again, your older relative or you yourself might find it's not as hard or as intimidating as you think. I'm even thinking I might have to try this out for myself. Don't forget your mental health. Keep up with your medications and to keep up with those counseling sessions, which I know practitioners are offering via phone appointments or via video conferencing tools. It's important to take care of ourselves, help our older adults to take care of themselves as well. You can think about prescriptions that you might need to be picking up. Your pharmacy may be able to fill those for a longer period of time than usual, so that you're reducing the number of trips that need to get made to the pharmacy. Also, I want to mention, not related to telehealth, but to health, and that is in particular for caregivers. You know, if you're a caregiver of an older relative, you probably have some emergency backup plans. You know, who's going to take care of your husband when you go on vacation? Well, now we're talking about who might be available to take care of your husband. What if you should become sick because of COVID or because of some other reason that makes it unwise for you to continue caring for your relative or unable to care for your relative. So it's a good time to be thinking about what plans you might have in place and how they might need to be modified, because perhaps right now some of the people you would call on to help you out if you became unable to continue your caregiving, maybe they're not available because of the added responsibilities that they've picked up around the COVID-19 virus. I have a website here. It's ready.gov/plan that has got a couple of different resources that can help people to think through emergency plans to be ready for whatever might be coming along. And if you have a little bit of time on your hands, even hopefully you won't need this emergency plan, but it might help you out in the future when you're dealing with something else. I know Dr. Dolben McNabb spoke last week about the risk that couples who have experienced interpersonal violence or maybe have never experienced violence within the home, whether verbal, physical, or sexual, could experience it during this time when we're squeezed together, sometimes in small spaces, and definitely during challenging physical and mental health periods. Older adults are also going to be at risk of abuse from a caregiver, from a spouse. And so it's important to know that that hotline.org site that was provided last week is going to be a good resource to access or to call if you have concerns about an older adult who is neglecting themselves, who's being abused, who's being neglected by a caregiver, who might just be so overwhelmed that they're having a hard time keeping up with their responsibilities and their commitment to their older relative. Also, within counties, you'll find adult protective services if you search for those. I have a couple of resources here. In Virginia, seniornavigator.org is the site that you would want to go to for really any kind of service that you might be looking for. And don't be dissuaded that you're not sure you found just the right one. Give them a call anyway. In Virginia, there's a no wrong door policy. So even if the office that you call up doesn't provide that specific service you need, they're going to get you connected to the office that'll be able to provide the help that you need. I'm less familiar with North Carolina. I know they're a partner in this series. It looks like, though, that the NC 211 is the best place to go. So you just pick up your phone and dial 211 and let them know what your needs are. They ought to be able to help you out. The last point I'll make about safety is that we know there are people who are unfortunately looking to take advantage of these stressful times. Financial exploitation is a major concern. Older adults are prime targets, and we need to be mindful of supporting our older family members or older adults with whom we work, that they're reminded of the kinds of things that they will never be asked to provide by offices that might be calling them up or posing as offices, legitimate offices, and calling them up. So we're doing okay on time. Are there any questions, Crystal, that I could address about some of these basic resources in the community before I go on to talk about things that might be a little bit more pleasant?
I haven't seen any questions come in yet. Certainly, I'll be monitoring the chat box or the Q&A box for any of you who have questions that come up as they arise. We'll dedicate some time at the end as well. I have posted those links in the chat box. There's also 211.org that was just posted in the chat box. Thank you, Jenny, for posting that. So just continue to plug on, and I'll monitor for any other questions.
Great. Thanks. I told Crystal that keeping up with advancing the slides and keeping up with my notes is going to be all I can handle. I can't follow a chat box as well at the same time. So now I want to talk about some of the important roles that older adults fill for us in our lives, and how low and high tech could be a resource to maintain those different roles. I've heard and read about some great stories that families and individuals are using to maintain roles that they have had as grandparent, as tutor, as mentor, as babysitter, as resource support for parents of young children. Those don't have to stop just because we can't be physically present with each other. There are great ways to visit, to share stories with each other. Some of them do require technology, and all of these are free. Even the Zoom app, and I'm going to tell you a little story about that. So Zoom is what we're using, although we're using the webinar version. So it gives audio and video. Multiple parties can join in. I have got a family dinner Zoom meeting tonight with my parents and my brother, all in different places. We have actually found that Zoom is better than phone calls, at least in our house. We've gotten to the point where we do not really like talking to my parents on the phone. And it's not because they're unpleasant company or I don't like what they have to say, but the internet phone connection is just poor quality, so that everybody ends up being frustrated before the call is over. With Zoom, we set up a time so people are not interrupted in the middle of the call. And if you're like me and you have a little bit of hearing difficulty, you have got somebody's face and you can read their lips a little bit to help make sure that you understand what you're hearing during Zoom. So that's what I'm finding is really good. And this is free right now. There are some limits on how long you can host that Zoom meeting, but it is a great resource that's out there for you. I have friends who have got family internationally, and they like to use the app WhatsApp. I don't have experience with it, but I know that it is a good resource that my international friends use to stay connected with their family. We've also got opportunities to write letters, and I'm going to show you a chance to do that. I've been sending weekly letters to a friend's 9 and 6-year-old, and have been told that it's a great way for the 9-year-old to practice their reading out loud, although I can't write in cursive. They aren't teaching that. He hasn't learned it yet. There are some resources online. Historically, we've had to deal with issues like pandemics and major outbreaks of difficult health conditions. Generations United is an intergenerational group with lots of resources about supporting family intergenerational relationships and relationships between young and old people who aren't related to each other. They've been advocating for universal vaccines for a long time, and they have a discussion guide that's designed for intergenerational conversations. It's a very long URL. I can get it to Crystal so she can add it to these resources, but if you start at gu.org, you can look up vaccinations or the health discussion guide for some fun and not all heavy and medically oriented topics to discuss around why we take some of the precautions that we're taking these days. So it can be a good way to talk to young people about how their lives are changing around hand washing and not touching things and wearing face masks and things like that. Older adults are a great font of information for young people. They could have a lesson to teach or to share in an activity. They might give their grandchild or great-grandchild some homework in advance so that that helps to occupy the child, might be helpful to the parents. There might be some materials that they need to gather. I have a friend who talked about her mom was going to schedule a science lesson with her grandchild who was in school, and had sent a list ahead or had ordered some materials and had them delivered to the home so that they could sit down and have 30 minutes together to work through that activity, complement what's going on in the virtual classroom, and give mom and dad a break as well. We often count on our grandparents and older adults to serve in those roles. They can continue during this time. You also have young people who can be teaching their grandparents things as well. So don't forget the skills and talents that our young people have. Let me take a look. I think that's the main thing I wanted to share on continuing roles with some technology. Of course, keep in mind the attention span and the tech fatigue that you or the communication partners might be having. So if you're picking out something you want to do with an older person, might do with a young person, if it's a big project, maybe it's something best broken up over several sessions, depending on the attention span and fatigue, or if at some of our houses, bandwidth issues, if other people are trying to get online at the same time. While some roles can be adapted with technology, some don't do so well with technology. Now we've got pictures here of family members visiting with an elderly relative at a nursing home. I'm assuming that this older woman in the nursing home is able to understand and comprehend why her family members are sitting in the bushes outside waving at her and talking to her on the phone. If you are a caregiver to somebody who has dementia, there is a chance that they're going to be really confused about why you are outside, and it could result in some emotional expression and some need-driven behaviors that reflect anxiety that they're experiencing or agitation that they can't get outside or get to the space where their relative is. So you need to be mindful of what the older person is able to understand and how they're able to engage. Those older, those adult children probably outside the window may be out there, not so much because of what the elderly woman in the bed wants, but because of what they need and what they feel like they need to continue doing. Share grace with yourself and with others. If you've got questions, if you aren't sure how best to support your elderly relative who may not be with you, who can't be with other family members, ask the staff members who work with them. It may be the case that you just need to share some information about the elderly relative's preferences, and that staff can support that as well. The Alzheimer's Association has got some resources, and I've got a link there. For almost all of these home pages, they've got a button, a banner at the top of the monitor that talks about COVID responses. So you shouldn't have to it shouldn't be difficult for you to find the resources that are specific to COVID-19. That's what I wanted to share there. I'm excited to share with you some new opportunities. I have, my parents are in their 70s. One of them was just getting started in a new volunteer role at a food bank and was told, we don't want you to come in because of your age. You are categorically in a risky segment of the population. Stay home. For some older adults, that can be really devastating, and it can result in isolation. It can leave older adults feeling like they are not valuable, that people are imposing ageist stereotypes upon them. If you know some older adults, or you are stuck at home not able to fill some of the volunteer roles that are so important to you, you can pick out some new roles that are virtual or that may be contact free and allow you to provide some support despite the limitations that we're facing. There is a really cool program that I've been learning about through Empowering the Ages. It's called Smile Share. And if you ever have joined a pen pal matching service, it's like that. Individuals or organizations can go to this website and indicate that they would like to receive letters from younger people, or they could say, I'm somebody who would like to write letters and be paired. Their exchanges are confidential. They're also screened for content to make sure there isn't anything inappropriate. And so people aren't emailing each other directly. Empowering the Ages is doing the facilitation of that. And it's only a couple of months old. It is a direct response to COVID-19. And that picture in the lower right-hand corner is of a gentleman receiving a handwritten letter, and some pictures that the letter writer must have thought they wanted to share with him. I'm real curious to see where that goes. Generations United has let us know that times are also difficult for grand families, and they have described at this link that I've provided here ways that individuals who might have more of a social justice and advocacy bent, that you can advocate to your representatives resources and supports for grand families during COVID-19. Those grandparents are trying so very hard to keep themselves and their grandchildren healthy because they know how important it is that they be available to each other to be a resource. I also found a number of different websites, one through AARP, one through a group that routinely matches volunteers with organization, and they have got virtual volunteer opportunities. They may look somewhat similar to Empowering the Ages. You're able to specify what your interests are, and they can make a match for you. Some of you may have expertise or experiences navigating mental health issues or working with people who have. And so that last one is specific to providing support to mostly young people in the form of texts who are dealing with mental health concerns. They provide online training. Any of these groups will provide online training and set you up so that you can be as safe as possible and helpful as possible to others in the community. So there are good things to do there. The last thing I wanted to finish with, because I know this is going on in my household, I'm getting texts from my siblings, why is she running around like nothing is going on? And it's coming into the news as well. Why are some older adults not heeding the warning to stay put? We know that it's good for their health. We know it's good for other people's health. We want our older relatives to stay safe, but they won't stay put. And that's, I'm guessing it's going to be different from person to person, but those older adults who aren't self-isolating believe and know that other people are counting on them. Other peers, age peers who are older, or well, they're not age peers then, who are older or who are more frail or in more groups of concern, they want to be helpful. It gives them a sense of purpose and connection. And they may not want to be categorized into this one big group of old people that equals vulnerability. They're resisting those ageist stereotypes. And rather than continuing to hound your mom or your grandfather about this, encourage them to accept help so that they can keep helping. They may be able to continue in some of their helping roles by using technology, so they're reducing their contact. They might take a break from some of their helping roles so that they can be sure to stay strong and be able to resume those roles when some of our restrictions are lifted. And of course, if they're going to keep going out, they can take extra precautions to make sure that they're staying as healthy as possible and not putting other people at risk by going out and about. So those are the tidbits that I wanted to share. There's a lot we could cover, and I can stop and see if there are any points of discussion, other resources people want to share, or questions that I or the group might be able to answer.
Thanks so much. There are some questions as well as some resources coming into the chat box. I'm going to ask people who are posting in the chat. I changed your permissions, so if you are chatting, for example, Jenny Biggs put a resource in there. If you would see if you're able to use the drop down in the chat box and send that out to all attendees, that would be great. Otherwise, I can copy it and send it out to all attendees as well, because those are great resources to have. But there is a question. Kevin asked, is there any service available where a caregiver person could call an elderly person on the phone for a chat?
Yeah, I would like to do some homework so I can get back to Crystal with something specific. The Sharing the Smiles is not involving phone calls, but I have seen, I'm here in Columbus, I have seen that there are some phone assurance efforts that are taking place. And so that's what you're talking about. And so let me do a little bit more homework. Is that all right, Crystal? And see if I can come up with something specifically. It's a
Sure,
great idea, great way to spend some time.
it would be great. Yep, I can share that out. Everyone who's registered for this session, I will send those resources back out to you. So Jenny has shared to all attendees a local resource for the 5-county region, Culpeper, Orange, Madison, Rappahannock, and Fauquier, agingtogether.org. Are there other questions or specific resources that you'd like to share or things you'd like to know or discuss? So Amy says she's been sending thinking of you cards to residents in local nursing homes, which is also a great activity for the kids to do.
And I love that. Thank you. And there are, if you're, like, I twisted my adult children's arms and I said, we're all going to write letters to this local nursing home. They're like, oh my gosh, what do I say? I don't know who this person is. I don't know who's going to get it. And you can find some of those resources online. Empowering the Ages would be a good place to start, kind of to give you some freedom to, don't let your concerns about what you're going to talk about hold you back from getting involved with something like that.
Thank you. There's a follow-up question. So what about an elderly person available to call and help other elderly people as a volunteer by phone?
We're gonna find that one in there too. And there's also this really cool possibility that people might engage in some of these new roles and want to continue them even beyond this period. There is, and of course the name is escaping me, it's a senior companion program. This is a federally funded program that is earmarked towards older adults to be helpers and somewhat social, somewhat instrumental companions and helpers to other older adults with some needs. And so senior companions is one thing that you can Google and look up. What I know of them is mostly about in-person visiting. And I can't talk and look online, but they may be have some resources in place now for some of the phone assurance and phone check-in that you're talking about.
Thank you. So Dr. Jarrett, can we get those resources and lists from you? And I can send that out in a follow-up email to everyone who is on this session.
Yep, I will do that after we get off of this call so that you've got them today, Crystal.
Great. Thank you. That sounds great. And so as we're nearing the end of our time together, I'll share one more piece in the chat, and someone mentioned their neighborhood is coming together to sew masks to donate to the Area Agency on Aging as well as to food bank volunteers.
There's great things going on, just terrific.
Agreed. And so as we're nearing the end of our time, we will follow up with those list of ideas as well as resources. We will include a link to the next session that's coming up in our Balance in Life series, which we are holding on Fridays at 10 a.m. I will share with those on this call. Some of you may be interested in another opportunity. It's not part of the Balance in Life series, but it is something that we, along with our colleagues, are offering and hosting. There's this session. There's no pre-registration required. It's on stress and safety. Really, this opportunity is on Monday. So log in if you have interest in that. It is particularly geared toward agricultural audiences and communities, but I would offer that there's probably great information for all of us there. The next in our session, we've covered a lot of things in the Balance in Life sessions. We've talked about working from home, schooling from home, being at home with young children. We've talked about marriage relationships. Last Friday, we talked about teens, anxiety, and stress. Today we talked about older adults, and all of those recordings are either posted on our Virginia Cooperative Extension website under COVID-19 resources, or they are in the process of being uploaded there. So next week, our human development team and our NC State partners decided to go a little lighthearted, but also address something that many of us may be looking for and asking at this time. And that is, how do we maximize the time that we have at home with our families? And so next week, we'll talk about family fun for all.